Today, more than 589 million people around the world live with diabetes. Their blood sugar stays high constantly and it needs to be lowered. But the real question is, how much should it be lowered? Because doctors have learned how to lower blood sugar decades ago, and what they didn't know was this. Does tightly controlling blood sugar truly prevent blindness, kidney failure, stroke, and heart attacks? Or was it just a number on a chart? To find the answer, doctors in the UK done the amazing job. They started a very large study called the United Kingdom Prospective Diabetic Study, or UKPDS. The study followed thousands of people with type 2 diabetes nationwide, for many years in many hospitals. And it had two main goals. First, to see if tight blood sugar control could reduce diabetes complications like blindness, kidney failure, amputation, and many more. Second, to see if one treatment or any specific medication was better than others. Like many other studies in the field of medicine and health, the participants were divided into two groups. One group received conventional treatments and most of these people were treated with diet alone. Their HbA1c, which is an indicator of blood sugar control over the past 3 months, was 7.9%, while the other group received intensive treatment. They used diabetes medicine such as sulfonylurea, metformin, insulin, and a combination of those drugs, which brought their average HbA1c level down to 7%. To put this more into perspective, an HbA1c of below 5.7 is normal. HbA1c levels of 5.7 to 6.5 is pre-diabetes, and anything above 6.5 means diabetes. If you don't have diabetes or if your blood sugar has been well controlled over the past 3 months, your HbA1c would be lower. If it hasn't been well controlled, it would be higher. The difference between 7.9 and 7% in the UKPDS seems very small, but this small change in diabetic patients makes a big difference. The results show that this difference in blood sugar control reduced microvascular complications by incredible 25%, which simply means 25% less blindness, 25% less kidney failure, and 25% less nerve damage and amputation. But don't be too excited yet, because intensive treatment also had some downsides. Most people in the intensive group gained weight, which is undesirable cosmetically and also increased the risk of tens of diseases, including heart attack and strokes. But metformin found to have the opposite effect. It not only caused weight gain, but people who take metformin alone lose some weight, which is beneficial cosmetically and for cardiovascular health. Abnormally low blood sugar episodes called hypoglycemia, which is a medical emergency and can be fatal, also occurred more often in the intensive treatment group. But in the UKPDS, over more than 27,000 patient years, only one death from hypoglycemia was recorded, which is a pretty small number compared to 27,000 patient years. This data showed that intensive treatment was safe and effective overall. For the second question of drug difference, the study found that among anti-diabetic medication, one medicine showed special benefits, and it was no medication other than metformin. In people who were overweight or had obesity, metformin was better than diet alone. It reduced patient weight and the number of heart attacks and strokes. No other anti-diabetic medicine in the study showed this heart-protecting effect. But the most important and surprising result of UKPDS was not even about blood sugar control. It was about blood pressure control. People who had tighter blood pressure control had much more better outcomes. And the study showed that every 10 millimeters drop in the top blood pressure numbers reduced the risk of heart attacks by 11%, while more than half of the patients used 2 or more medicine for controlling their blood pressure, but no one type of blood pressure medication was better than the other. In the study, what mattered most was controlling blood pressure, not which medicine was used. And the UKPDS also taught doctors another important idea, that there is no magic number where blood sugar suddenly becomes safe, but it needs to be controlled. What UKPDS did teach us all in all is this three. Lowering blood sugar helps protect the eyes, kidneys, nerves, heart, brain, and many more organs. Metformin helps protect the heart in overweight people who are majority of type 2 diabetes population. And controlling blood pressure may be even more important than controlling blood sugar. If you and me remember one message and only one message from the study, we should remember this. In type 2 diabetes, blood sugar control is important, but blood pressure control can save even more lives. Subscribe if you like.